Hi, this is Five Questions with an ISHLT member, and I'm Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And today we welcome Josh Diamond from the ISHLT's Pulmonology professional community. Hi, Josh.
Hi, nice to see you.
Yeah, nice to see you too. Thanks for joining me today. Before we dive into our five questions, maybe you can just share who you are, what you do, and what your role is in ISHLT.
Sure thing. I'm a lung transplant pulmonologist at the University of Pennsylvania in Philadelphia,
Mhm.
and I'm the Associate Medical Director of our lung transplant program. And within ISHLT, I've been a member of the Leadership Advisory Forum, and for the last 2 years, I've been a member of the Program Planning Committee.
Awesome. Well, thank you for your dedication to the society. And I know people really appreciate all the planning that you do for the annual meeting. So thanks for that. What got you involved in ISHLT originally? How did you find the society? And now that you're here, what keeps you here?
Sure. So ISHLT was actually the first society that I actually attended a meeting for when I was a pulmonary fellow. I remember going to the Paris meeting in 2009, and my mentor at the time, Jason Christie, Jason's now my division chief, like took me around and introduced me to people at the meeting with like, hey, this is Josh Diamond. He's really interested in lung transplant. And at the time, I had no idea about lung transplant in general at all. But I actually now collaborate with a lot of the people who I met at that first meeting. And ICHLT, from my perspective, really is the premier organization for folks who are interested in lung transplantation and trying to move the field forward. And I think the nice thing about having our meeting coming back in person this past year was the ability to bring some of our trainees and try to get them involved in the society the same way that Jason did for me.
Yeah, that first meeting is really special for a lot of people. And somebody bringing you always makes it even more special.
Definitely.
So, what inspired your career path? You said you found ISHLT while you were a pulmonary fellow. How did you get there? How did you end up doing that?
I think it kind of happened in a similar fashion. So when I first started as a pulmonologist, I was actually most interested in being an intensivist.
Mm.
But early on in my time as a fellow, I really started developing an interest in lung transplant. And I think it came from the mentorship that I received
Yeah.
from Jason from a research perspective and from Rob Kotloff, who was my fellowship director. Kind of saw the two of them as kind of like the epitome of what I thought a pulmonologist would be, and sort of tried to model some of my early career decisions based on sort of what I saw from them, and really sort of snowballed from there into becoming a mixture of a clinical translational researcher as well as a transplant clinician.
It really is remarkable how those mentorships make such a difference and take you on that journey. Um, Tell me about a meaningful milestone, either for you personally in your career. You also talked a little bit about the field of lung transplant and advancing that field. Where are we at? What are some important milestones right now?
Well, I think one thing that we just experienced here at Penn this past summer was we did our 1500th lung transplant.
Wow.
I think it was a really nice, remarkable milestone. Made us sort of one of the sort of most experienced programs in the country.
Yeah.
And I think about sort of all of the patients that we've had the ability to have a profound impact on their life, and it really makes me sort of proud of the sort of career that I've decided to pursue.
Absolutely. It's such an impact you've made on so many people. And those big round numbers, they're hard to conceive of, but they are
Yeah,
really special.
definitely.
So, when you think about the future of lung transplantation, of pulmonology, what do you see on the horizon? What's coming down the pike? What are you seeing in the science? What should people be kind of looking out for?
I think what I'm most excited about is pharmaceutical companies have started to get interested in lung transplantation.
Yeah.
And I think we have the potential to really push the field forward. I think there's going to be a bunch of clinical trials that are going to be starting in the next 1 to 2 years, looking at sort of important outcomes after transplant, trying to intervene upon, prevent primary graft dysfunction, improve physical frailty and function, and really try to make a meaningful difference on the development of chronic rejection of clot after transplant.
Yeah.
I think in my career time, we have the opportunity to actually really make profound improvements in the outcomes that we see for our patients.
That's so exciting. And I obviously am excited to see some of those things coming up in the annual meeting over the next few years after those trials get going. So,
Definitely.
well, when you're not involved in transplantation and saving lives and getting up to 1,500 transplants, what are you up to? What's your idea of a perfect weekend?
I think it's getting outside in nature with my family. My daughter, I have a 12-year-old, and my wife. Well, we like to get out, go hiking. The weather's going to start to get cold soon. We're excited about going skiing for weekends.
Yeah,
So I think spending time with my family out in nature is really what I enjoy doing most.
me too. I'm right there with you. Well, Josh, thanks so much for taking some time to chat with me today and for everything you're doing for ISHLT. Is there anything else you want to share with our community that we haven't yet covered today?
No, I'm looking forward to seeing everybody in Denver in 23.
Absolutely. Me too. Take care.
Bye bye.